Centre and its conversion into Dr. Joyce Laboso Mother and Child Hospital. This petition was committed to this committee, and I believe you are conversant with it. Maybe just to highlight the prayers of this petition, the petitioners pray that the County Assembly, through the clerk, investigate the circumstances under which, one, the county government of Bomet altered the purpose and identity of Cancer Centre to Dr. Joyce Laboso, MCH. Two, the petitioners want to know or to establish whether public participation was conducted in accordance with the Constitution and the County Government Act before such a significant change of purpose and name was made. Thirdly, they fully recognize that maternal and child health services are equally critical. Reducing maternal and infant mortality is a key national priority and aligns with global health goals. Therefore, it should not be viewed as a conflict between two priorities, but rather an opportunity to strengthen both. Fourth, they want to investigate the circumstances under which, they want the County Assembly to stop any attempts to erase, rename, or repurpose the facility in a manner that defeats its original cancer-focused mission unless an alternative, fully fledged cancer center of equal or better capacity is first scheduled. They also want to ensure they want the County Assembly to ensure public participation in decisions affecting health infrastructure development. They also want the County Assembly to intervene to halt or review the plan to establish the MCH facility in the proposed location, and also to allocate adequate resources in the county budget for cancer diagnosis. They also want the County Assembly through this committee to recommend the establishment of a cancer center in the same location and make any further recommendation it deems fit in the interest of justice, accountability, public health, and preservation of public trust and health. So to bring you to speed, when we received this petition, we have considered as a committee, and as a practice, we normally invite the relevant stakeholders to assist us in answering the prayers of the petitioners. We have equally invited the petitioners, and we've had a session with them. They've expounded on the need for, or the call to have this petition before this committee, and we felt it fit to invite you as well. Later on, we may also invite the Committee on Health in the Assembly and any other relevant stakeholders. So without further ado, I want to give it to you, Waziri, so that you give us whatever response you have. Then later on, I'll allow my members to react to the responses that you have. Maybe you've noted that the committee is not full, but we are hoping the rest of the members will join us as we proceed. Welcome.
Thank you, Chair, Honorable Chair, and members. I have a written submission here, and I want to read, and then we will interact with, and I have given copies for us to address. And I want to thank your team for giving us this chance to respond to the petition. We refer to your letter, which we received on the 20th of April this year, in which the County Assembly Petitions Committee invited the County Executive to respond to the petition number 2 of 2026. The petition was presented by Ms. Joyce Cheronosise on behalf of concerned residents of Bomet County. The petitioner alleges that the county government has cancelled the Chepkriket Cancer Centre and converted the site into Dr. Joyce Laboso Mother and Child Hospital. Having reviewed the issues raised, we wish to clarify the following. One, on gazettement and degazettement. The alleged degazettement of the cancer center is not factual. The proposed cancer center was never gazetted, and therefore there has been no legal or administrative process of the gazettement as claimed in the petition. Number 2, on establishment of the Mother and Child Hospital facility, the development of Mother and Child Hospital is in line with the county's mandate to strengthen maternal and child services, which remain a critical priority. The facility is intended to complement but not replace other specialized services within the health system. On cancer service integration, a cancer center cannot operate as a standalone unit. It requires comprehensive support services, including diagnostic, laboratory, imaging, pharmacy, and inpatient care, among others. These essential components are already incorporated within the mother and child infrastructure, making the current development a strategic foundation for future oncology services. On land utilization and future expansion, the mother and child facility occupies approximately 10% of the total available land at the site. This leaves adequate space for future expansion, including the establishment of a fully fledged cancer center on sufficient resources when sufficient resources are mobilized. On public interest and planning, the county government remains committed to progressive phased development of health infrastructure to ensure sustainability, efficiency, and maximum benefits to the residents. In summary, the County Executive Committee wishes to place on record that the comprehensive cancer has not been cancelled. Cancer Centre has not been cancelled. The project remains active. A steering committee is in place, are operational. Benchmarking visits have been completed. Consultation with the National Cancer Institute of Kenya have been concluded. The county government has employed oncologists of several of different cadres. We have also trained a pediatric oncologist. We now operate oncology clinics at Longisa County Referral Hospital. We conduct community screening outreaches. We have integrated oncology into primary health care. In fact, some of our health centers have what we call thermoablation machines, which can treat survivors. 9-acre Chepkriket site accommodates both cancer center and MCH. It can accommodate. The facilities will share common infrastructure. They will remain separate clinical functions. This incorporated or this integrated model is validated by the benchmarking we did at the MCH. Benchmarking visits to Moi and Teaching Referral and Chandaria Cancer Centre will show some of the things that we learned, and that is on evidence of benchmarking. The county government conducted a formal benchmarking at the request or the advice of our government to visit the MTRH in Eldoret. MTRH is a regional center of excellence for cancer in Western Kenya. The purpose was to explore collaboration to examine integrated model of cancer care that is with Chandaria Cancer and Chronic Disease Center. The delegation inspected the linear accelerator. This is the main machine that is for therapy in the cancer. That is the radiotherapy. It examined the CT simulator. That's another major machine. We toured chemotherapy units where they give chemo. We reviewed facility directory boards, which demonstrates an integrated layout that involves chronic disease clinics, hematology and oncology clinics, chemotherapy administration suite, radiation unit on the ground floor, tumor board rooms for discussion on through telemedicine, and the research done by AMPATH. Key lessons from MTRH is integration. That was a key lesson, that this facility needs to have other services integrated into it. This facility operates within the main hospital. It shares infrastructure, like the roads, electricity, support services, and it maintains specialized function. So we have adopted this model, and we have said the cancer center and the MCH can coexist on one hub. They will share roads, utilities, and as I mentioned, That one of the key lessons. We consulted the Cancer Institute, which is the main body that deals with issues of cancer in Kenya. The county government held a formal consultative meeting with National Cancer Institute Kenya officials. We were very lucky to meet the chairman, who is the senior-most person who established the Cancer Centre in Eldoret, MTRA. It is the statutory body mandated to certify and approve all cancer centers in the Republic. It approves architectural designs, it guides construction standards, it ensures regulatory compliance. It even facilitates the acquisition of some of those very important equipment, which some of them have to have compliance to protect radiation to the community. So you cannot do anything without involving, and we have involved them. So the National Cancer Institute Kenya Service Delivery Charter was presented at this meeting. We were given the charter. We saw its vision and its mission and what it is supposed to do. So they reviewed the Bomet proposal. They assessed the 9-acre site, which we have. They confirmed its suitability for a comprehensive cancer center. They endorsed the integrated approach, which we learned from MTRH, and they provided technical guidelines for equipment, staffing, and certification. In fact, we were told that before even when you start constructing, you should also be doing training for specialized people. There are people who are called physicists. If you don't have those ones, you are as good as not having a cancer center. So we are still having that in mind, that we need to recruit. Yes, and the equipment will need to be reviewed as a team progresses. So these guidelines have been adopted as a blueprint for the project. So in other words, we have not neglected the cancer dream that the other leaders had for Bomet. The establishment of governance structures to ensure we get this cancer, and there are pictures in that document which shows that we were there. In fact, some of them show the team that is here participated in that, and even the equipment that the first set of pictures is to the Chandaria Center. The second set is with the National Cancer Institute. So the county government has established a Cancer Center Steering Committee chaired by His Excellency the Governor, Professor Hilary Barchok, with the undersigned serving as secretary. I am the secretary to the team. A core secretariat was formed, chaired by the Chief Officer for Health. 3 technical working groups were created. There is a project management and coordination, equipment planning and procurement, and clinical service training and education, because those are the things that we need to do. These structures meet regularly. They report to the steering committee. Progress is tracked against established milestones. We even had a concept note that we've shared with stakeholders whenever they come to us, so that we get support. There is also ongoing cancer treatment or support on clinical services in Longisa, so that we don't have to wait for the cancer center to be established. Something should be done as we progress to have our own center. The county government operates a dedicated oncology clinic at Longisa County Referral every Wednesday. We give drugs, chemotherapy. They are administered to patients who have been referred to us, who have been assessed by others, and they come to us. 502 patients received treatment in 2025. 246 new chemotherapy cases were registered. A qualified medical oncologist is employed full-time. A pediatric oncologist has recently completed specialized training and has returned to give active service. And we have 12 healthcare workers working in this oncology center. So prevention and outreach, which is our mainstay for cancer, the county government has conducted cancer screening outreaches across all 5 sub-counties. Care planning, as I said, we have a healthcare program. As I said, we have some of the sub-county facilities offering thermoablation services. Community health promoters help with channeling patients whenever there are symptoms. Human resource development, as I said, we have those two specialized medical workers, the oncologist. There is also the pediatric oncologist, and we have a pathologist who is undergoing training, because pathology is also one of the other keys. So apart from the oncologist, we need to have a physicist, and we need to have a pathologist to be able to help us. I think it should be in third year or fourth year. Yes. So integrated hub model. So the rationale for integration is that we have enough site and land for both facilities. Integration offers distinct advantages because of the shared infrastructure, therefore to reduce cost, including even the power and the water supply and even the waste management. Although we'll have a specialized waste management for the facility, we have that. It also improves patient care, because there will be patients who will be coming for other operations, but they can still be served. Like mothers who have come for the usual regulation can be checked for cervical and breast cancer. We copied, or we want to model on the best, and Moi Teaching and Referral Hospital has an ISO certification known as 9001-2022, which is actually good for such, and we want to model and replicate this proven model. So specific responses, Chair, to the prayers by the petitioner, especially part 1, where they say investigate why there was alteration of purpose. And we want to respond that the government has not altered the purpose of the cancer center. It has not. The Comprehensive Cancer Center remains a priority project. It's not a standalone, it's a priority project. It retains its dedicated budget, governance structure, and procurement pipeline. The mother and child is a separate project addressing a distinct health priority. Both projects proceed in parallel. The integration was technical, not a policy change. It was informed by benchmarking and regulatory guidance. Number 2, prayer number 2, public participation compliance. I want to say, Chair, that public participation was conducted in accordance with the articles of the Constitution, 10(2)(a) and Section 87 of the County Government Act 2012. The County Government Integrated Development Plan 2023-2027 was subjected to public participation. Both Cancer Center and MCH were prioritized. The integration of these two, on one side, was a technical planning decision by Cancer Technical Committee. It did not constitute a material change of purpose or repurposing of the required. I must say, Chair, also that before the project started, there was a public participation. In fact, being a project that was funded through World Bank and the county government, there was a public participation. Number 3, recognition of the mother and child and cancer center as not being in conflict. I think this is where we concur with the prayer, that these two can exist. Maternal health and cancer care are complementary priorities. And in fact, cancer is one of the problems mothers and children will face. And therefore, having them being together will be a good thing. The integrated model strengthens both. Cervical cancer, as you may have heard, is leading cancer among women in Kenya. It is detected during maternal health visit. When they come, you can screen and they can be detected. Like breast cancers and even pediatric cancers, you detect them whenever they come or are channeled to through the referral system. And it is good if they don't have to go to another place, because the same people who can detect can be part of the team to manage them. So the county government adopted integration precisely because it strengthens both services. Prayer number 4, stop attempts to erase, rename, or repurpose the cancer center. No erasure, renaming, or repurposing is occurring. We will have the original idea of Chepkriket Centre still be within that facility, because that was the aspiration, an identity that was given during after the passing of the child of the first governor of Bomet, Governor Isaac Ruto. It respects public emotion investment on the site. So it's not erasure. As we said in the beginning, there was no gazettement of that name, but there is that public feeling that we should not forget that that move that was given at that time. We've named the mother and child in honor of Dr. Joyce Laboso. In honor of her, she died of cancer. She was a champion of maternal health. In fact, one of the key things they did together with the current governor was a visit to Longisa. And because of congestion, they said, we need to do something. We would have probably put this facility in Longisa, but because of land challenges, the available land at the Chepkriket site has been utilized. Prayer number 5, ensure public participation in health infrastructure development. We have conducted and will continue to do that. Detailed design forums will be open to public when we start. Site visits will be open to stakeholders. Progress reports will be published as required, and the county government commits to transparency throughout implementation. Prayer number 6, intervene to hold or review the mother and child hospital plan. This is where we want to request this committee to really respectfully that we decline this prayer. We pray that this should not happen. As you've heard from our first presentation, that these are a comprehensive. I mean, this is a progressive approach towards attaining or fulfilling that dream. So if we alter, we will be setting us back. It will be setting us back in the approaches that we need to have reduction in mortality of children, mortality of mothers, and even obstetric and emergency care, which has been really below the national average. I want to say that we've given priority to this in our CIDP, and halting this will harm mothers and newborn. It is unnecessary. So we really pray that this should not be something that we could that could be allowed. This committee should help us to ensure that we succeed in the aspiration of having the two service provisions occurring together. Number 7, allocate adequate resources for cancer diagnosis and treatment. Resources have been allocated, and we are awaiting approval by the county assembly, especially on the construction of the cancer center. Additional resource mobilization is ongoing with development partners. As I said, we keep talking to them. In fact, currently, I think we've talked to Safaricom. My chief officer has had the privilege of meeting Safaricom Foundation. And part of the equipment that we are asking them to support us with include what will help in mother and child. You know, the bed, the diagnostic equipment could be general, but they will be also available for cancer patients. So that's what we are doing. We commit to ring-fence cancer funding to supplement requests when required. Number 8, Chair, recommend establishment of a has started. As I said, we are arguing that by establishing the mother and child, the auxiliary services, and when it will be in place, will be will complement it. It is integrated in that 9-acre site. The committee is invited to recommend expedited procurement for radiotherapy equipment. Some of them are very expensive. They are not found locally. It has to be sourced internationally, especially like what we are calling the linear accelerator and the specialized CT scan for radiotherapy. Number 9, make further recommendation in the interest of justice and accountability, public health, and preservation of public trust. The county government welcomes this and further recommendation. We specifically request the committee to recommend fast-tracking the NCI certification and the national government partnerships and equipment once we start. Because like certification and registration, you cannot register a cancer center before you begin building and acquisition of the equipment. So we will require the support when this comes. So in conclusion, Chair, in view of the above clarification, the ground upon which the petition is based are not supported by fact, especially or planning consideration. The concerns raised have been adequately addressed within the county development framework. So it's not like we've neglected the cancer issue, and we have committed ourselves to addressing the concerns raised by the petitioner, and we've said this has already started. We remain committed to engaging the public and stakeholders while ensuring that health investments deliver equitable and comprehensive service to the people of Bomet County. Recommendation to the Petitions Committee. We respectfully request the committee to first dismiss the petition insofar as it alleges cancellation of the Cancer Centre, the allegation being factually incorrect. Second, conduct a site visit to the site, a 9-acre site, Chepkriket land, to verify its capacity to accommodate both facilities. Third, recommend County Assembly approvals of increased budget for health sector development. This is because this is a very intensive, financial intensive project. I think the accelerator alone could be in billions. It's not a very cheap, and it may require the collaboration of the International Atomic Agency, and through the support of the County Assembly, the agencies will know the seriousness that Bomet County wants to do for cancer, especially in this region where cancer is really a menace. So, Chair, I want to stop there, and I want to ask my team to chip in. Let me ask the director to if he has any, with your permission, Chair. Let me ask let me start with the County Director of Health Services, Dr. Sawe, to briefly just chip in one or two things that I may have. So, thank you.
Thank you so much, Honorable Chair, for this opportunity. As elaborated by our CC, we are committed to supporting the cancer management within the county, and we have supported all organization building blocks, starting with the human resource, where we've built capacity for our healthcare workers. We now have an oncologist in our establishment, as well as a pediatric oncologist. We have a clinical officer oncologist, as well as nurses oncologists. So in terms of human resource, we have that in place. And as elaborated by our CC, the technical team and the governance structures that has been established, we are working closely with the structures that are in place to ensure that this project is come into fruition. So if we get the sufficient funding from the county assembly, especially increasing the allocation for development infrastructure, we will be able to make steps towards ensuring that we have this infrastructure in place. At the moment, the allocation to the health sector is around 24%, and we believe if we get around 30% to the health sector and to increase the development in infrastructure, we will be able to start off and support this endeavor. So as part of the technical team, we are ready to support. And we also have oncology pharmacists who are in training to ensure that the chemotherapy that are being administered to our patients within the oncology clinics are safe. So with this endeavor, we are ready to support every step of the process. Thank you very much.
Thank you, Chair. Let me ask the Chief Officer also.
Thank you, Chair. First, let me appreciate that we are here to discuss a very serious issue of cancer. Chair, we want to And because it's an issue in Bomet, we also, like Waziri has said, we have tried with the available resources to make sure that at least we are putting in place some mitigation measures. And when we talk of the human resource, when we talk of even health centers at the moment, and having some cancer screening equipment, and speaks to the effort from the department to ensure that we are doing something. When we say that over 520 patients were seen in our oncology center in Longisa, with new around 254 new patients being enrolled on that platform, and measures to ensure that we are battling with this disease burden. Number 3, Chair, what is available in Chepkriket is a 9-acre piece of land. You cassette a facility that is completed. You don't cassette a land unless the cassettment in the aspect of public, private, and all that. So we have not cassetted mother and child even as the mother and child hospital, because we need to have the board in place, we need to have the medical superintendent, and then now we can have it inspected by the KMBDC, and then that will be cassetted. But what we are saying is, because the cost when we went to MTRH for the benchmarking to the Chandaria to the National Cancer Institute, the bare minimum that we required for the construction of a comprehensive cancer center plus the equipping is at the tune of around 500 million. So putting 500 million again as the available resources, it is only prudent that we have this